If you're dealing with acid reflux, you've likely come across two very different treatment approaches: all-natural alginate therapy and prescription medications called PPIs. They may sound similar on the surface, but these treatments work very differently in the body. Knowing the difference can help you make more informed choices about managing reflux, short-term and long-term. In this video, we'll break down how each works and how they compare. Reflux happens when stomach contents move upward into the esophagus. Symptoms aren't always caused by excess acid. Movement and pressure play a major role. Factors like high-fat meals, slow stomach emptying, and relaxation of the lower esophageal sphincter make it easier for contents to push upward. This is why treatments that focus only on reducing acid don't always fully resolve symptoms. There are two main ways reflux is treated. One focuses on physically blocking reflux, and the other focuses on reducing acid production. Alginate therapy works by forming a gentle protective barrier that sits on top of stomach contents, helping prevent reflux from moving upward. PPIs, on the other hand, are medications that reduce how much acid the stomach produces. Alginate therapy works mechanically. It forms a gel-like barrier that sits on top of stomach contents and helps prevent reflux from traveling upward. Instead of changing how much acid the stomach makes, it focuses on keeping contents in place. The goal is to stop reflux from moving up in the first place. Since it doesn't change how much acid your stomach makes, digestion continues as usual. PPIs take a very different approach by targeting acid production rather than the physical movement of reflux. There are several alginate-based options available for reflux support, including Reflux Gourmet, Gaviscon Advance, and various generic alginate suspensions. Among these, Reflux Gourmet is often considered a top pick because it works quickly without altering digestion and relies on a physical barrier rather than medication. Its clean formulation, fast action, and easy use after meals make it a practical option for consistent, long-term reflux support. Common PPI medications include Omeprazole, esomeprazole, and pantoprazole. These medications help reduce the amount of acid the stomach produces, which can lessen irritation to the esophagus and allow inflamed tissue time to heal. They're typically taken daily and may take days to weeks to reach full effect. PPIs are often used for frequent or persistent reflux symptoms and are available over the counter or by prescription. Common side effects can include headache, nausea, or digestive changes, so longer-term use is typically clinician-guided. Alginate therapy doesn't change how much acid your stomach makes. Instead, it forms a physical barrier that sits on top of stomach contents and helps prevent reflux from moving upward. Because of that mechanism, it works quickly and is typically used after meals or drinks when reflux symptoms are most likely to occur. It's taken as needed and is considered a non-drug, all-natural option for reflux support. PPIs work very differently. They reduce stomach acid production by blocking acid secretion over time. These medications are usually taken daily and may take several days or even weeks to reach full effect. PPIs are often prescribed for more frequent or severe reflux, especially when acid suppression is needed for healing. The main difference comes down to movement versus acid production, and understanding that distinction helps guide which approach may be best for you. Alginate therapy may be helpful when symptoms are triggered by meals, throat irritation is present, or a non-drug option is preferred. This approach focuses on managing reflux as it happens, without altering normal acid production. It's a great non-drug option. PPIs may be used when reflux symptoms are frequent or more severe, when esophageal damage is present, or when a clinician recommends acid suppression. This approach is often used to reduce ongoing acid exposure and support healing over time. The right option depends on symptoms, severity, and medical guidance, and in some cases, both approaches are used together. Individual needs vary, which is why treatment is often personalized. Reflux treatment isn't one size fits all. Alginate therapy and PPI medications work in very different ways, and each has a role depending on symptoms, timing, and individual needs. This approach is often used to reduce ongoing acid exposure and support healing over time. Understanding how these options work, rather than relying on trial and error, makes it easier to choose an approach that actually fits your situation.